Mobilization of the week, we're looking at ankle dorsiflexion mobilizations using a band. It needs to be a pretty heavy resistance band, so typically they're called super bands or pull-up assisting bands. This is really going to work when you do find that maybe you're stretching your ankle, you get a lot of pinching here in the front. What happens is there's the joint right here between part of your ankle and part of your tibia and fibula. They have to move and glide together. So when that's not happening, you can get a little pinching of the bones coming together, or kind of pinching the capsule there. So typically when you go to ankle dorsiflexion, the talus, which is one of the ankle bones, glides backwards. And if it's not doing that, you'll get a little bit of that pinching sensation. So what we can do here to kind of assist with that is take this band, get nice tension on it, place it on the ankle joint, which will kind of give it a slight glide back, and then we can glide forward. So you may find when doing this that it actually decreases that pinching sensation, anything like that. It's not going to be pulling a lot of force, but just giving it that little glide to help it kind of pull it back, which can really help with everything. Like with any sort of passive techniques, guys, we always need to follow up with an active technique. One of the ones that I like to do is like a eccentric heel raise. Let me show you that real quick, just to follow it up, really lock in that motion. But it would look something like this, coming up, slowly on down, all the way until you feel that stretch, and then back up. Another important aspect, guys, is the placement. So we're going to show you that right now. So placement is key. What you really want to focus on is keeping the band on the ankle. So basically underneath your lateral malleolus, which is there, because you're trying to glide the talus or the ankle bone backwards. If a lot of people, what they'll do is they'll put it up here. If you put it too high, you're not going to be doing that. You're going to be pulling, and once again, it's not a lot of motion, but you will be pulling this bone kind of back while you're trying to push it forward. So it's not really going to be doing anything for you. So make sure you have it on the ankle joint. That's why one reason I like to have it elevated. It lets it pull on the ankle joint rather than just straight back. So give that a try, guys. That is one of the most important aspects, so don't forget.